Doctors do not want to die in the intensive care unit. Did you know that? A survey showed 90% of the doctors have written a will saying that I should not be taken to the intensive care unit. But every patient is forced to go into the intensive care unit. And you say, if you go to the hospital, intensive care unit. Right, Niranjan? Yes. Coronary care unit started in 1962 in Kansas City. It spread like wildfire all over. Even a village had coronary care unit. Can you just? Off ಮಾಡಿ ಆಫ್ ಮಾಡಿ ಮಾತಾಡಬೇಡಿ ಖಾಲಿ ಆಫ್ ಮಾಡಿ. A recent audit showed a conventional coronary care unit has not saved even one extra life. What a doctor is not told in the medical college is what is called NNT. You know NNT, number needed to treat. You don't understand that. Very simple, I'll tell you. The largest study on blood pressure showed to save one patient of a possible stroke in the next 5 years, Angelina Jolie, we have to treat 850 poor people with poisonous drugs for 5 years. And the adverse drug reactions have by then killed 75 of them. Did you get that? You're saving possibly one. We have been giving aspirin left, right, and center after the age of 40, saying that you don't get a heart attack. Now, the audit showed aspirin taken routinely without any indication might or might not prevent a heart attack. Might not is more forceful. But it will certainly produce 10% more cerebral hemorrhage, which will take you to heaven in sleep. Now, these are not known because many of us cannot read research papers because we don't know the intricate statistics in that. And these statistics are sexed up, doctored, and produced. I'll give you a nice book called Science Without Sense. This is about statistics in medicine. Medical science is not a pure science, it's a statistical science. If you ask me, medical science is an art. You know what art is? Art is that which makes a patient's day. And we must make the patient's day. And that's our main concern. That's what we're here for. When I was a student in the 50s, now I'm doing this study. I've already started the study in the United States of America in 10 hospitals with some money from somebody there. When we were students, we had hardly 5 or 6 drugs. But the per capita death of the number of patients who came to the hospital and went home horizontal or vertical, almost the same as today. So for evidence based, I'm doing that. 10 hospitals in America. I'm negotiating with 2-3 hospitals in the UK. Try to see 2 slots. When I was a student in the 50s to 70s, and maybe 2000 to 2020, to see what happened. This kind of audits only show us where we are. Now, friends, health requires only very simple things. Clean drinking water for everybody in this country. You can close 40% of the hospital beds. Toilets for everybody, another 10% can be closed. And if you have 3 square meals a day, according to the UNIDO, uncontaminated by human and or animal excreta, you can close another 10% of the hospital beds. Sri Virendra Hegde ji was saying, our villages don't get the best facilities. You know, all of you must read this new book which has just come out from in London by a professor of history. His name is David Wooten, and the book's name is Bad Medicine, Doctors Harming Patients Since Hippocrates. For 2,500 years, our high-tech medicine was bloodletting for everybody. Bloodletting. 127 AD, Galen said, bloodletting will relieve all sick. George Washington was bloodlet for typhoid fever and he died. Napoleon Bonaparte had tubercular pericarditis, the bloodlet. If you in a tubercular pericarditis where the heart is compressed, if you reduce the blood volume, if you reduce the blood pressure, patient will die fast. But do you know what happened? No poor man died because he didn't have the money to go to doctors. The poor people, even in our villages, are safe because they don't get unnecessarily intervened. And you are right. They are now better fed. They are now better educated. The children go to school and they are well informed. So they are healthier than our folks in the towns. Thank God there is an industry called health tourism industry. I said, fine. You can kill outsiders, but don't kill Indians. What is the industry? Tourism industry, medical tourism industry. I can't understand. I'll tell you what happens now with this Vajpayee scheme. Shettar ji was talking about Vajpayee scheme. There's a big case in Mangalore. Hospitals now have what are called motivators. Motivators. They go to the village and say, "Nimigella kaile, all of you can understand Kannada? No, no. You're all, you're not checked up, If you check up, then we can save your life." So they do it. Next day the van goes and everybody's checked. They went to a village and picked up 35 people there. Old ladies, you are there. Everybody said, you have coronary artery disease, you have this, you have that. And then brought them like, the packed birds in a van to the hospital. And within one day, there were 6 of them were done angioplasties. One child was operated on the heart for replacing the valve. And so many other things are done. And for their bad luck, 4 of them died. Now, 4 people dying in a small village is big news. Now the hospital was in trouble, everybody is in trouble. So the government says at that stage, let bmhegde investigate. I said, look, am I a bloody fool? All the 3 doctors concerned are my students, so I'll be biased. I won't give a judgment against my students. Do you know what the chief minister told, I believe? Illella avaru students adru avaru bahala honest, avaru kottare. So I told him I'm going to America. 2 months I won't be there. So you carry on. After that, when I come back, I'll see. They couldn't wait that long because there is so much of political pressure. I don't know what they did. Now, why is this coming? Government is paying the money. So somebody is paying the money. Our business will have to go. I'll tell you something. To have a cardiac surgical setup today, you require about 60 crores. Now, if you borrow that money from the bank, because nobody will put his black money and show it to them. You borrow it from the bank. Though you have money, you borrow it from the bank. Now, what is the interest on 60 crores? You require 4 bakras every day to just meet with the thing. See, this is business. We have sold our soul to the devil, wrote William Wordsworth, a sordid boon.